Hey everybody, I have Dr. Gary Prins with me today, and Dr. Prins has been a Trojan benefit service user for many years. So, Gary, what office are you practicing in?
Well, Los Alamitos Dental Care in Los Alamitos is where we are, and it happens to be where Trojan's headquarters is.
Okay, so in California.
Yeah,
Good.
exactly.
So tell me what you like about it. Why did you invest in it? How's it helped your practice?
Wow, I can't remember why I started with it, but it seemed like a good idea, and it's been a wonderful benefit to our practice because it's allowed us to focus on the patient portion so that we can make things comfortable for patients. We've always accepted insurance assignments and this and that, but when I started with Trojan, we did binders. We got a binder, and so we thumbed through the binder, and then we started getting 5 1/4 floppies, and then 3 1/2 floppies, and I think at one time you had a tape thing we put. Maybe not. But
well, there was the microfiche in between there somewhere.
The microfiche.
And then
yeah.
the 3x5 floppy, and then it's the CD, and then now it's on the web. So the information that Gary's talking about is the benefits that we researched, the breakdown of benefits, and then it links into, in this case, the Trojan coverage table.
Mm-hmm.
So now, if we're saving you time, obviously, if Trojan is doing research of benefits for you, what does your office do with that time that can generate revenue for the business?
Well, outsourcing is something dentists don't do enough of because there's so many companies that do wonderful work, and if you can free your staff to do more productive things, then you've really moved ahead, and then of course, calling patients, having the time to interact with patients, and so many things that the office can do when they're not bogged down by calling insurance companies and getting put on hold. Things add up, and this is just one of those tools that is so essential in a practice. It's just not even optional in my mind to know what kind of coverage your patients have. But that's important to you. If you have the type of practice that you can just say, Mr. Smith, it's $8,000, and you can pay us right now, or you can just take a hike. Well, that's one financial policy, but I think it's always nice to be patient friendly. The other thing is, if you allow your patients to do their own billing for insurance, they're going to get taken to the book, eaten up alive, because they just don't know how to fashion it, how to, the things to say that the insurance companies need to hear so that they get the maximum benefits. It's a benefit for the patient, and then you're providing care to the patient, and it goes, and there's many different types of care. Dental care, caring for the patient, helping them to, get the benefits that they're paying for, which have been sort of frozen. I mean, $1,000 max when I started practicing. Insurance was just starting when I started practicing, as a matter of fact. It was sort of new. That was 1976, which is the year Trojan was founded, but coincidentally. And so, anyway, it's, it's kind of tight with insurance, and now more and more practices are becoming insurance, what's the word, dependent on insurance. PPOs.
Now you mentioned something about when you're sitting with the patient in the treatment room. I know a lot of dentists don't necessarily do what you do, but you enjoyed looking at the Trojan plan, and then you were able to kind of ballpark what the patient would owe, that sort of thing. How did you do that?
Oh, it's just a quick little estimation. You have some things about the plan. You have the maximum. You have the different basic and the major and the preventive percentages. So you can, in your head, you can figure out what they're going to cover, especially with the maximums sort of frozen at $1,000 or $1,500. If it's several crowns, well, your benefit's going to be $1,000. Period. That's it. So anyway, because it's actually easy to do in your head. But as you're talking to the patient presenting a treatment plan, it's nice to know, regardless of the patient's economic profile, it's nice to know how how the coverage is going to look like,
Mhm.
and just, you know, it's just nice to know. It's a factor.
Yeah, and then
In a
Trojan
treatment
is the
plan,
one
it's a
that
factor.
gets that information for you versus your
Absolutely.
staff having to go out and get
Absolutely.
it.
It's all integrated. It's all downloaded. It's all automatic.
Mm.
Now you have your Identify process, which I'm not familiar with, but it's sort of new. And
Well, your staff's been using it for a couple of years, just so you know.
absolutely.
And they love it. I already have a testimonial from your office manager.
Oh, nice. Okay.
Yeah.
Yeah.
So you would definitely recommend it then to
Oh, yeah.
dentists.
It's essential.
Yeah.
It's
awesome.
essential. Yes.
Well, thank you very
You're
much
welcome,
for your
Jody. Good to see ya.
time. You too. All right.
All right.